Good morning, good evening, and or good afternoon. It's your girl Kesi and welcome back to my channel. So today we're going to be talking about drugs. As you may know, I am a legal drug dealer. I'm just kidding. I'm a nurse. And today we're going to be talking about drugs. So a couple weeks ago, I don't remember what week it was because I've been trying to plan this video for a while. Pretty much what I did was pull a couple patients 9 o'clock meds and I recorded which ones I was going to give at the time. And so what I'm going to do today is talk to you guys about the common meds that I give on my job. My specific floor, we are a urological surgical floor, so we get everything post-op, and the majority of our surgeries are urological, and we get overflow from med surg, so we can get anything from, you know, hypertensive crisis to sickle cell crisis. I'm covering a urological prostate surgery, I'm covering a vascular surgery or a femoral femoral popliteal bypass, and sickle cell crisis. So I hope you guys enjoyed today's video. Trust and believe that all these medications were given, and if they were not, trust and believe that I would have been docked at the end of the day because they run a narcotic and medication report every day, and I would also be in my manager's office. So yes, they were given and I go back to work tomorrow. So this is a total educational video. I did record all these clips about a couple of weeks ago, not just now. I don't have the medications here. I'm just trying to do a little disclaimer because people be tripping and they trying to mess up people's vibes, you feel me? But ain't nobody gonna come mess up our vibe because we here to learn. We're here to make things easy. My motto, I haven't made up the motto yet actually, but in my head the motto is Kesi, make nursing easier than when nursing school makes it seem like. Or let them know that it's much easier than nursing school makes it. So yeah, I hope you guys enjoyed today's video. Enjoy. So patient number 1 is going to be our urological prostate procedure. So basically it's going to be a simple prostatectomy. These patients usually get partial or full removal of their prostate, and they usually go home with a Foley. It's a #1 rule on our floor. If it's a prostatectomy, do not take the Foley out. Even if you have a doctor's order, question it. It's never to be taken out after surgery. So basically today's patient is pretty much discharging today. They usually discharge the day after, and I'm going to be talking about the 3 meds that I gave them that day. So the first med would be Colace or docusate sodium. These are class laxatives, and so the therapeutic action is of course to be a stool softener. So the indication of Colace will be to prevent constipation after surgery, to avoid straining, of course, because most of the time these prostatectomies or any other surgery we have require them to have an incision and a closure of the incision. We don't want any kind of straining on the incision to possibly, you know, mess things up inside, mess up the healing process, pop up with the suture or the dermabond. You don't want any of that. So we give stool softeners so you can go in your own time, and it pretty much is going to be soft enough for it to pass easily. I'm going to remind you nurses, and I'm going to keep reminding you nurses, while you're giving stool softeners, nurses, be sure to assess the color, the amount, and the consistency of their stool, because you would never want to give a stool softener to somebody who has like runny stools. You know, what's the point of giving a stool softener at that point, you know? So the second med we're giving this patient is Claritin. We all know Claritin. I used to take Claritin, but I'm more on like the natural allergy relief these days. But Claritin, of course, is a class antihistamine, and the therapeutic action is of course to decrease or prevent the allergic reaction during like seasonal allergy time. So redness in the eyes, swollen eyes, itchy nose, runny nose, all those, we all go through it. Not really. I envy those people who don't have seasonal allergies actually, because I chew. One thing with antihistamines, they do have a mucous membrane drying effect. So nurses, be sure that your patients are intaking oral fluids while they're in the hospital, because you don't want their mucous membranes in their mouth to become dry, because you don't want them to form ulcers, and then there'll be another problem. So make sure your patients are intaking enough water every day so they won't get dry mouth. And you can instruct that as well whenever they go home and they're taking this at home. Tell them just to make sure that they're taking in enough fluids. The next and last med for patient 1 is pantoprazole or Protonix. Today we're going to be talking about the IV route. This is a class PPI or proton pump inhibitor. So here's an NCLEX tip or I guess school tip, if you see a med that ends in prazole, those are usually proton pump inhibitors. Oh, my dress is on backwards. I was wondering why my neck was itching. Y'all, I was sitting here without this on for a little bit, and so I just threw it on so I can record this video. Wait a minute. Wait. Okay, I was wondering what was scratching my neck. It was the tag. All right, that's better. Yay. So back to business. Wow, that feels much better. Wow, why didn't y'all tell me my scoop was up too high, bro? Y'all fake. Y'all fake. Shout out to the people who noticed. The therapeutic action for these is to work as an anti-ulcer agent, and it pretty much decreases the acid in the stomach, or the gastric lumen, if you will. So nurses, with IV proton pump inhibitors or with IV protonics, if your patient can swallow, see about getting it changed to the PO version, because if your patient is going to go home with PO protonics, why are they getting the IV? You don't want them to become dependent on the IV and then the PO doesn't work. And it said in the drug book that it should be changed to PO ASAP within 7 to 10 days. So hey, just get it changed. See why they're on it. Now, of course, if your patient can't swallow, by all means, keep it IV. So patient number 2 will be our vascular surgery. So the first med is lorazepam or Ativan. So this is a class benzodiazepine or benzo. If you think benzos, think PAM. These are the ones that end in PAM, if you want to take that to the end class. Their therapeutic action is to decrease anxiety. They also can work as an antiemetic or work as a sedation agent if you use it IV. Last week I actually gave this as an antiemetic IV because of course the PO, they were throwing it up, and the IV Zofran was actually affecting the QT interval of their EKG. So yeah, you never want to give something that affects the heart, because that defeats the whole purpose of the actual stay at the hospital. We're gonna make it worse. No. So they actually started to give her IV Ativan, which actually helped. So there's that. So nurses, remember, with any controlled substance, the patient can overdose, okay? So you always want to know the... Hello?
Which one? I found 3. Overdose. Death of a punk rocker.
I'm okay. That was creepy. I'm sick of the government listening. Stop listening. My heart rate just went up. But, so like I said, with any controlled substance, the patient can't overdose, so you always want to know the antidote. I'm like really tripping out. So the antidote for any benzodiazepine is flumazenil or what is it called? Romazicon. So know that. And you want to be aware of the patient's history when it comes to benzo overdose, because benzos can be used to prevent, that's the other indication, it can be used to prevent seizures as well. Think about it. If you're using Ativan for say to decrease seizures in this patient, right, and they overdose on Ativan, and now you go get the flumazenil and you give them the reversal agent of this Ativan, what do you think will happen? They're gonna have a seizure. So you always want to consult with your docs on that, because that will be a scary situation. I've never been in that situation, but with research and like in the drug books, they say watch out with that. Don't give them flumazenil. We need to find some other route about that, you know? So yeah, that's Ativan. So the second med we're going to be giving this patient is oxycodone hydrochloride. So of course, this is a class opioid, and the therapeutic action is to decrease moderate to severe pain. Now, if it's like, you know, not too like, they're like a 3-4 type pain, I mean, Tylenol, extra strength Tylenol, gabapentin, you feel me? Like, they don't need oxycodone for a 3 pain scale. And they usually set that up in the system. They're usually good on that. Because opioids works in the central nervous system to control the pain, because the nervous system is connected with your breathing and all of that, it can cause respiratory depression. You want to always make sure pretty much that your patient is stable. You never want to give a narcotic, especially IV. Oh my God. You never want to give a narcotic to a patient whose blood pressure is low, whose heart rate's low, whose respiratory rate is 12. You know, like that is, no, we don't want them to stop breathing on our watch. So you always want to make sure their blood pressure and stuff are stable, and if not, call the doctor, see if you can get them some Tylenol, gabapentin, or something non-opioid for the time being until their blood pressure is back up, you know? So there's that. All right, so the next medication we're gonna be talking about today, the atorvastatin or Lipitor. This is a class, let's see if I can remember, HGMO, HMG CoA reductase inhibitor. Almost had it. So this is a pretty much a let's bring that cholesterol down drug. I mean, I don't know why they couldn't just say that, but you know. So this is basically a lipid drop-in medication. You usually give these to patients who have hyperlipidemias or hypercholesteremias, so it can decrease the lipids in their bloodstream, because that can also cause atherosclerosis, which is pretty much the buildup of fatty lipids in the bloodstream, which can cause vascular problems. Here's an NCLEX tip for the nurses. If you see a statin, atorvastatin, fluvastatin, lovastatin, etc. statin, it's a lipid drug. Think lipids, think cholesterol first. NCLEX. Yeah, so that's that one. So the next med is atenolol or tenormin. This is a class beta blocker. We all know what beta blockers do. They pretty much slow down the heart rate and bring down the blood pressure. So those are the main indications for atenolol. So of course, if something is to bring down the blood pressure or slow down the heart rate, you want to always make sure that all those things are not too low. So I always make sure that my vitals are done before I give their morning meds that has to do with any kind of blood pressure medication, because I want to make sure I don't need to call the doctor and tell them, hey, their blood pressure is this, their heart rate is this. Are you sure you want me to give this? You always give, you know, get the doctors a heads up that they're not looking so good or their vitals are pretty low. Maybe we should stop this for a couple days. You never want to tell the doctor what to do. You know, we're here to just, hey, I think that you should think about this, even though you actually are telling them what to do, but you can't ruin their ego. I'm just kidding. But yeah, make sure you assess the vitals. Everything you need to assess vitals most of the time. First things first, check the vitals. You'll see what's going on. The next medication is cyclobenzaprine or Flexeril. This is a class skeletal muscle relaxant. This one's therapeutic. Look at this one. Y'all remember that one? She hanging on. So the therapeutic action for this is the reduction of muscle spasms or hyperactivity in a limb without the actual loss of function. You never want to like relax it too much, you can't use it, you know. The indication of these are pretty much to manage pain to do with muscle spasms. So reminder, nurses, be sure to assess your patient's pain, their range of motion, and their muscle stiffness. Since this medication works specifically with the muscles, you want to make sure that they're not losing function and make sure they can still move in and see how stiff the actual spasms are making the limb, you know. So always assess that. So the next one is polyethylene glycol or Miralax. We see this on the side of the aisle at Walmart in the big purple bottles. Miralax, the laxative class laxative. Drink this, you will poop. That's a dog. Is it? Where are your parents? Therapeutic action for this is to pretty much evacuate the GI tract. Pre-procedural or also given to patients who are probably on like opioids or something that can cause constipation. So of course, like I said before, with the collates, you want to assess the color, the consistency, and the amount of stool the patient is having, because you never want to give this stuff to somebody who's having loose stool, again I say. And the last medication that we're giving this patient actually had like about 5 more meds, but I'm gonna make this video a little bit shorter to help y'all out so y'all can go about y'all business. The last med we're giving this patient is one of the most important medications for this patient because of their vascular history and their vascular surgery that they had. So the next one will be clopidogrel or plavix. Plavix is a class platelet aggregation inhibitor. So the therapeutic action for plavix is to decrease the occurrence of atherosclerosis events. Atherosclerosis is pretty much the buildup of fatty plaque in the arteries. Now, atherosclerosis event can be a stroke, can be an MI, or vascular death. Relating back to the patient that we're talking about, this patient was having struggles with circulation in a specific limb. So because of that, they wanted to go ahead and like thin out the blood so they won't actually lose complete circulation in that limb, so it won't completely die off before the bypass, you know. So usually they're started on this. Nurses, remember that the patient before the procedure, they need to have been off this medication for at least 5 to 7 days, and if not, make sure your doctors know before the procedure that they have been actually taking their plavix. Sometimes, I mean, the patients get in the routine of taking their medication and they forget, oh, I forgot to not take this one. So you always want to ask before they actually go to their procedure, did you stop your plavix? Okay, you didn't. Let me call your doctor to make sure that this is something that they know. And of course, you want a charter to protect your patient and also your license. So our last patient, patient number 3, is a sickle cell anemia crisis. So we all know what sickle cell anemia is, hopefully, and if not, go look it up real quick. But we're going to be talking about a sickle cell crisis. So sickle cell crisis is basically sickle shaped blood being clogged or occluded in a specific spot in the body. It can happen anywhere that blood flows. So it can be in the back, in the legs, and like the lungs, you know, it can be anywhere in the body. And when it's a crisis, it's pretty much accumulating in one spot, causing excruciating pain because oxygenated blood isn't getting to like the organs, the muscles, the part of the body that is being affected. So basically, imagine, you know how you sleep on your arm or something, like you're in class, you sleep on your arm, or you're in bed and you lay like this and you wake up in the middle of the night, you can't feel your arm, and if you possibly hit it, it's like tingly or stinging. Imagine feeling like that, like in your organs or in your muscles all the time without even having to sleep on your arm. These individuals usually come in with excruciating pain, and we usually put them on a PCA pump or a patient controlled analgesic pump. So basically, whatever the doctor orders, we program it, the patient will press it, they'll get that specific amount, or sometimes they'll get a specific amount over an hour and they're still able to press it within the intervals. So that's a PCA pump. So the first thing we're giving our patient is a scopolamine patch, which I didn't know wasn't only transdermal or PO. You can also give this sub-Q, IV, and IM. Didn't know it. Now you do, or now I do, I guess. So this is a class anticholinergic. So it works, of course, to decrease nausea and vomiting from motion sickness, or decreases nausea from opioids, or after like being under general anesthesia. A lot of people are usually nauseous, so we put a scope patch on them just, you know, prophylactically, or if they have a history of post anesthesia nausea and vomiting, then they'll usually come to me with the scope patch on already. So in our case, of course, our patient is on his PCA pump. He probably gets nauseous from the opioids. We put a scope patch on him for 3 days. So the next med would be the cinelax or Cinecot. This is a class stimulant laxative, and of course the therapeutic action is to work as a laxative. Like I said before, nurses, check the consistency, the color, and the amount. I've been saying it in different orders, but you get what I'm saying. Of the stool, don't give it if they having diarrhea, baby. Don't give it if they having diarrhea, baby. Don't give it if they having diarrhea, baby. All right, y'all get what I'm saying. Don't give it if they having diarrhea, because we don't want the patient to have diarrhea even more, and we don't have to give them Imodium, blah, blah, blah. You get what I'm saying? So the next med is, of course, another stool softener. With the people with sickle cell anemia, with sickle cell crisis, we usually are giving them opioids after opioids. They're getting opioids all day, and they also have breakthrough pain opioids. This patient, I think, had oxycodone as well. So you want to just make sure they bowels don't go to sleep, because opioids can cause constipation. So he's getting cinelax and Colace, just in case. Y'all, look at this sad guy. Look at this sad guy. But the last med we're giving our patient is folic acid. This is a class anti-anemic medication, and the therapeutic action is to work with anemias to make sure that the patients are still producing red blood cells or platelets. These are usually indicated with people with sickle cell anemias or any other anemia. You also may heard in nursing school that we give folic acid to moms for fetal development, normal fetal development. Nurses, just make sure your patients know that if their urine is a little bit more of an intense yellow, it's probably from the folic acid, because that's just one of the side effects. It's nothing to be worried about. But yeah. And those are all our meds, y'all. I hope y'all enjoyed this video. I hope y'all learned something today, actually. I had a lot of fun actually going through my meds, and I hope this was super informative for you guys. Be sure to like this video and subscribe. Talk to me in the comments and follow all my social media below. And I'll see y'all in my next video. Bye.